Hello, everyone. With us today is Dr. Stephanie Poon. Thank you very much for being here, Stephanie. It would be great if you could introduce yourself and tell us a little bit about who you are and what you do.
Thanks, Abhinav. My name is Stephanie Poon. I'm really happy to be here today. I'm one of the heart failure cardiologists at Sunnybrook Health Sciences Center. I'm the medical co-director of the Heart Function and Rapid Cardiology Clinic there, as well as an assistant professor at the University of Toronto. But also my other hat is that I'm a co-chair of the Canadian Cardiovascular Society Heart Failure Quality Indicators Working Group as well. So I'm very, very pleased to be here to talk about one of our exciting initiatives that we have in collaboration with the Canadian Heart Failure Society, as well as Think Research.
Wonderful. Well, why don't you tell us a little bit about this really interesting initiative?
Sure. So I think it all started from the fact that we know there is a lot of variability in the way that heart failure patients are currently treated. We know heart failure is a huge problem. Currently, over 650,000 Canadians are living with heart failure, and every year you can add 92,000 people to that list. So if you're interested in heart failure, there will always be a job for you. I guess that's the bottom line. But at the end of the day, particularly in Ontario, when we started doing an environmental scan on how well our heart failure patients were being managed, we realized that certainly there could be improvement in their outcomes. For example, the 30-day readmission rate in Canada stands at about 21% and really hasn't changed over the past decade. And we know that heart failure carries a lot of morbidity and mortality for our patients, which translates to higher costs for our healthcare system too. And we also know that we have a ton of evidence-based medications that if you use them at the right time, at the right place, for the right person, that you can actually improve these outcomes for our patients. But unfortunately, standard of care is not uniform everywhere. And when they did an environmental scan, for example, in Ontario in 2013, they saw this huge practice variation, which was resulting in poor outcomes for our heart failure patients. So one way that we know to improve the outcomes would be to have standard procedures, so best practices, where we would have a standardized order set incorporating all of the latest evidence-based guidelines of the newest medications, of which quite a few have come down in recent years. If we incorporated all of those things into one single document and one order set, then by utilizing this, we would be able to improve patient outcomes, reduce rehospitalization rates, and thereby ultimately reduce healthcare and institutional costs as well. So when we did a poll amongst everyone at the Canadian Heart Failure Society, a lot of us already had implemented heart failure order sets at our own institutions. But we realized that we needed to get the news out there because we know that heart failure patients are not only taken care of by cardiologists. As a matter of fact, the vast majority of our patients are looked after by general internists as well as primary care providers. So being able to ensure that no matter where you lived or who looked after you for your heart failure, you would definitely be able to get the best care possible with all the evidence-based medications that you would need. So that was what drove us to create this heart failure order set. And it is now available on the Canadian Heart Failure Society website.
Wonderful. So if someone Googles Canadian Heart Failure Society and heart failure order sets, it'll show up?
It should show up. It actually has a separate tab for it on the website. And the thought was that we would provide this free for everyone at any institution, and that each institution could then sort of adapt it locally to meet their own needs. So there is a paper format, but since Think Research collaborated with us on this, there is also the capacity to incorporate this into your EMR as well with their assistance. So, but our thought would be that the paper version of it would be accessible via the Canadian Heart Failure Society website, and anyone would be able to download it and use it for free.
And so what are some of the outcomes that could be associated with implementing this type of order set in a hospital or in a inpatient unit? Are there any studies that have looked at this, and what are the advantages of having these order sets versus just not having them?
Yes, that's a very good question. As a matter of fact, there have been a couple of clinical trials that have looked at this, and we know from the results of these trials that the implementation of standardized heart failure order sets decreases length of stay by at least 1 day, and also decreases mortality as well. So by using these order sets, you can make people live longer and keep them out of hospital in terms of reducing their rehospitalization rates in addition to their length of stay. And all of that ultimately translates to lowering the burden, not only for the patients and their families, but also for the cost with respect to what our healthcare system is paying for the care of these patients as well.
And so what are some of the challenges that may occur when trying to implement some of these order sets?
Well, we know it's not a one-size-fits-all. When creating this, we really tried to hone down the core components of what would be the most important aspects to include. For example, we've included all of the evidence-based medications used in the treatment of heart failure with reduced ejection fraction, including things like ARNIs and SGLT2 inhibitors and ivabradine, as well as clinical pearls associated with that.
Wonderful. Well, this is certainly a very exciting and innovative initiative that is being led. And so thank you for bringing that to our attention. And if people want to find out more, you could just Google Canadian Heart Failure Society inpatient order sets, and it should come up. So thank you very much, Dr. Poon, for being here. As we wrap up this interview, we know that all of us are stuck indoors in social isolation of some sorts. In what ways are you sort of unwinding and relaxing?
Oh, well, I have brought my piano practicing skills and brushed them off a little bit. It's been a while since I've actually had time to sit down and play piano like I used to. Back in the day when I was 17, I used to, compete in the Canadian music competitions and played with the Hull Orchestra. I used to go on the Young Artist Performers program on the CBC radio, but that seems like a lifetime ago, so I gave it up for a while. But now that there's more time, I'm back at it. So it's been nice.
Well, that's wonderful. Well, thank you very much for being here. We really appreciate it.
Okay, thank you so much, Abhinav, for having me.